World Health Organization says experts are meeting tomorrow to determine whether to declare the Ebola epidemic in Central Africa a public health emergency of international concern. This after a family crossed from the DRC to Uganda earlier this week to seek treatment. One of them, a 5-year-old boy, died of Ebola on Tuesday. His 50-year-old grandmother, who was accompanying them, died yesterday. Health officials say the cases mark the first time the virus has crossed an international border since the current outbreak began in the Democratic Republic of Congo in August of 2018. The latest epidemic has already killed 1,400 people in eastern DRC. Uganda's health ministry says 27 others who'd been in contact with the family are under close observation. At least 6 other suspected cases of the virus have been reported. Ebola is spread through contact with bodily fluids, causing fever with severe vomiting, diarrhea and bleeding. So to find out more about this, the Red Cross and the World Health teams on high alert, as I said, following confirmation of Ebola cases in Uganda. SABC Correspondent in Uganda, Ssenyange, joins us now from Kampala. A very good evening to you, Leon. Let's talk about the confirmed number of cases. Now, we mentioned 2. Are there any more?
Well, good evening from Kampala. Well, the latest that we've been able to get from the Ministry of Health here is that no cases have been reported yet since those that had been announced on Tuesday evening. And like you had said earlier, the 5-year-old boy and his 50-year-old grandmother died over the last 2 days. However, the Ministry of Health earlier today actually met with officials from the Ministry of Health of the Democratic Republic of Congo. They were keen on strengthening and sharing ideas on how to mitigate this particular situation. It is the first time that any cases have been reported in Uganda. Uganda has over the last 10 months gone through a really rigorous preparedness to avert any occurrence of the Ebola victims or cases in Uganda. This time now they have changed the mode to a responsive mode, which of course means that they are doing everything in their confines to try and ensure that no more cases have been reported. And yes, none has been reported since Tuesday.
So, Leon, this family that's come from the Democratic Republic of Congo, is it correct that they're from the epicenter of the outbreak, which is the eastern part of the DRC, which is closer to that part of the Ugandan border?
Well, yes, the major issue around here actually, and like for the family that has come up in this particular situation, is the cross-border movement between Uganda and the DRC. The DRC is ultimately the epicenter of this particular outbreak that broke out in August last year. And yes, several border areas, about 12 or if not more, border posts have been open around Uganda and the DRC. Several others are unmanned, others are not entirely the official ones. So there's a lot of movement between Ugandan citizens and DRC citizens crossing over, especially for trade or even for school or even visiting relatives across. So this in one way or another has been one major concern for both the officials on both sides. And yes, for Uganda, a lot of work has been done to ensure that the cases that come from across are treated or even better still prevented from spreading. So the case that was reported on Tuesday is only the first of its kind that has come through over the 10-month period in which Uganda has tried to prevent any cases coming into Uganda.
Let's talk about the preventative measures being undertaken by health officials, including the Red Cross. What training has been involved, especially for community-based volunteers?
Well, the Red Cross says they have tried to do a lot of sensitization, trying to inform the locals and the citizens from both sides about how Ebola is spread and any particular symptoms in case and any family member or even a friend shows any signs, what they can first do. But now that is just at the community level. But the greater part of it all is that more than 5,000 health workers have been trained and most of all are vaccinated against Ebola. So that means they have quite a lot of a human resource or a reasonable human resource to deal with the situation. Several Ebola treatment units have been set up around the particular area within Uganda in which they can deal with the situation. Of course, this kind of situation comes with the greater challenge, which is the resources, the financial resources. Uganda and its partners, as well as the World Health Organization, have spent as much as $18 million in trying to prevent the spread of Ebola. That in itself is quite an amount of money, and even still more may be needed in trying to effect that the response mode in which Uganda now has shifted to can entirely avert and contain the Ebola virus.
So we'll talk about the resources and what they're for or where they're being targeted in just a moment, Leon. But I'd like to find out about the efforts in terms of risk communication. What messages are being sent out to communities?
Well, from what we have seen earlier today and much before is that several posters are being printed on what exactly communities can do on trying to prevent any cases around them. The Ministry of Health in Uganda has, as of this Thursday, banned any public gatherings. That in itself is one area that is going to actually help curb the spread of the disease. And yes, like I said earlier, posters are being put out, radio shows are being hosted on which much of the Ebola information is being put out, and the health workers themselves are talking to family members and the communities within them. Local leaders are being told to preach the gospel of prevention of Ebola in case they have a friend or a relative, anybody therein that shows any signs and symptoms, they must report to the nearest health center, and that in itself will help prevent any spread. So yes, a lot much more of information is being spread out via radios, posters, and even still through the local leaders.
Now, Leon, we know through past Ebola outbreaks that when the tragic end comes for somebody who's infected with it, relatives are often not mindful of the fact that they have close contacts with their loved ones while they're grieving. You spoke about the resources earlier on. Is there education on how to provide proper burials and the proper equipment for that?
Well, not much has really come out on a situation like that, but the situation for most of the areas that are within the catchment area of and a potential spread of Ebola, there's quite a lot that is still being done. Yes, most of the local health workers there are being kept within particular confines to ensure that they themselves do not contract Ebola, and that of course helps with trying to prevent the spread of the disease. But for the locals, and like I said earlier, the cross-border movements are a bit of a challenge for the Red Cross and the health officials here in trying to prevent Ebola. But the screening is being done at the cross borders, and with the screening, of course, once anybody is suspected to have any signs of Ebola, is withdrawn from the community or is withdrawn from the group of people they are in, and even those that they have been around with are kept in the treatment center and of course are taken care of and treated for any signs and symptoms. So yes, there is quite a lot of work being put in to ensure that individuals themselves therein can know what exactly to do once they suspect anybody as to have Ebola.
All right, thank you very much for that, Leon. Ssenyange is SABC Correspondent in Uganda. There have been warnings, apparently, according to authorities, that their fears that it might spread to neighboring countries of Rwanda, Burundi and South Sudan. But of course, we'll keep an eye out on that.